Agents often used but not recommended for insomnia by clinical practice guidelines. Trazodone, a serotonin-specific antidepressant, is sometimes used for insomnia. However, there are very few trials describing the efficacy of trazodone for the treatment of insomnia. The advantages of trazodone for insomnia include its availability in a generic form, lack of tolerance or dependence, and lack of anticholinergic and arrhythmogenic side effects. However, orthostatic hypotension, sedation, and potential falls can be problematic, particularly in the elderly. OTC antihistamines, e.g., diphenhydramine and Tylenol PM, doxylamine and Unisom, are less effective than benzodiazepines in the management of insomnia. These agents are frequently avoided because of potential anticholinergic side effects, the risk of residual drowsiness, and being on the Beers list of medications to avoid in the elderly. Barbiturates, e.g., secobarbital, Seconal, are strongly associated with abuse and dependence. Use for more than 2 weeks is associated with tolerance, dependence, and adverse events. Barbiturates are not recommended for treatment of insomnia because of their side effect profile and potential for drug interactions as a result of hepatic enzyme induction. Of note, barbiturates also increase the risk for falls and cognitive impairment in the elderly. OTC melatonin is considered a dietary supplement and not regulated by the FDA. It has been studied for sleep latency in both adults and children, and is often used for patients with circadian rhythm problems or jet lag that contribute to insomnia. Tiagabine, Gabatril, generic, inhibits the uptake of GABA and is approved for seizures and sometimes used off-label for insomnia. A meta-analysis found that both objective and subjective measures for sleep latency did not meet clinical significance. In elderly patients, tiagabine is associated with residual effects and reduced alertness. Valerian root is an herbal supplement not regulated by the FDA and sometimes used as a sedative hypnotic or as an anxiolytic mostly for sleep onset latency, but with conflicting results overall. Benzodiazepine-like withdrawal syndromes, cardiac disturbances, and hepatotoxicity have been described. It may require up to 4 weeks of nightly use for significant relief to occur. L-tryptophan is an amino acid supplement not regulated by the FDA that is absorbed and then converted to serotonin, vitamin B6, and melatonin. Patient-reported measures showed only a modest decline, which was not found to be clinically significant. L-tryptophan might cause a condition called eosinophiliomyalgia syndrome, EMS.